Hello, my name is Florence Nightingale by Jalitza Soto. I was born in May 12, 1820. My nickname was Lady with the Lamp. I got this nickname carrying a lamp with me in late hours of the night. I was the first nursing theorist, founder of the modern nursing, opened the first school of nursing, and taught many nurses my nursing practice. My theory is the grand theory, environmental theory. Manipulated the environment to facilitate patients' health. The environment is crucial to the patient's health. Nurses promote clean, quiet, peaceful environment to promote healing. Minimal exposure during surgery, such as making sure the tools were clean, the skin was clean before surgery, making sure only the site was exposed that was being worked on. Like I said, clean technique when providing care, such as washing your hands, which is very important even today. Bathing the patients to minimize infections. You want to make sure that the patient is clean, because if they have a scratch on them, if they have an open incision, and they're dirty, it's a great risk for infection. Keep the clean air throughout the areas where patients slept, making sure the windows were open, to circulate air, making sure there was no odors where patients were sleeping. Like I said, maintain pure air, pure water, efficient drainage, cleanliness, and light. This is just a picture of me and my patients. Okay, so this theory connects to all these things: person, health, nurse, environment. Focusing on the person's needs, not the disease they're inflicted with. People have repetitive powers, and nurses need to focus on these powers and heal them back to health. Health is a state of well-being. Patient's environment can affect someone's health in a big way. Like we were saying earlier, if their floor is dirty, the air is dirty, there's nurses are not washing their hands, that could affect the patient in a big way. The nurse's role is to heal patients, promote cleaner environments, including pure water, a quiet environment, light, warmth, and diet, and manipulating the environment in order to promote a patient's health. So, I would take my patients near the light in the daytime so they could have sunlight, making sure they were warm. I would cook, a good diet for them. I would cook, high calorie diets for them, making sure that they were eating in order to heal. And the environment. The environment is the chief source of someone's health. Keeping it clear and having clean air can affect the patient greatly. So I found our nursing, this is the nursing research, and this research I found has to do a lot with the theory that I am presenting. The nursing research study that I found that uses the nursing theory is one called the Evaluation of a Pulse Xenon Ultraviolet Disinfection System to Decrease the Bacterial Contamination in Operating Rooms. So this research talks about how cleanliness is a contributing factor of surgical infections in operating rooms. Standards manual cleaning alone is not enough. When cleaning manually, 47% of surfaces are appropriately disinfected, meaning that, we go in, to our operating rooms and we try to clean it manually with our hands. We try to make sure everything is clean, but we forget that we use our hands to push things away. So when we're pushing things away, such as the rollers or whatever, we recontaminate them. The portable ultraviolet light germicidal device employing Paul xenon lamps has shown to decrease the number of pathogens. It uses a xenon UV light flash lamp to kill viruses, bacteria, spores. It is effective in killing about 62 to 81%. So it's a big difference in between, us doing it and having this light do it for us. So this can be used between OR cases using a cycle of 2 minutes, being effective enough to eliminate more than 70% of bacteria. So this light, pretty much what it's stating is that, after or before someone's getting surgery, they use this light, and this light is supposed to eliminate and decrease the bacteria, pathogens, viruses, and it's supposed to just, it kills more than 70% of the bacteria, more than what we do manually. So I thought this was, it was, it had to do a lot with the nursing theory that I'm presenting, because it's all about your environment. If your environment is dirty, you're more, at risk for infection. And there's a link there if you want to take a look at it. It's interesting. And now a patient case study. I had a patient where she was a diabetic, had pressure ulcers in both of her heels. She had MRSA in one of her heels. The nurses did treatments on her heels daily, putting the cream that was ordered and changing the dressing. This patient ended up getting MRSA in both of her heels. The reason why she got MRSA in both of her heels was because the nurses didn't change their gloves in between, the heel treatments. They continued to work on both heels with the same glove, causing cross-contamination. These are the things that we try to prevent with patients. We try to do clean technique or sterile technique, never cross-contaminating someone's wound. We wash our hands to do the best, to do these basic things, not to cause more harm to the patient. So this is a perfect example. You've got to continue to do, as nurses, we need to make sure that our environment is clean, our hands are clean, we're changing our gloves in between, in between our wounds. Sorry. Conclusion. So the environment is the main thing I emphasize on. Having clean air, clean linens, fresh water can improve a patient's health dramatically. Nurses are here to make sure patients are getting the care needed in order to improve health, focusing on the patient's needs instead of the disease. As we continue to clean the environment and focusing on the cleanliness, we can change the outcome of someone's life. With the simple thing, such as keeping the environment clean, can make a big difference. Thank you.